in the genome, those 20,000 genes, not a lot, but there's probably maybe 10 to 20 that can be altered to predispose to Moya disease. So as you go from patient to patient, they may have a different gene predisposing them. But you know, obviously if you're Asian, there's much more likely to be this one gene. Identification of the genes that cause Moya disease will let us ask the question, do these genes cause other vascular diseases in other family members? And that's important information to the family members. And if we find the genes, then we can use those to predict who's at risk for Moya disease and possibly other vascular disease. And this is really the point of my research, is to use genetics to identify who's at risk so you can prevent the complications, the strokes, the disability, the deaths due to these diseases. So my whole research is focused on vascular diseases that if we know who's at risk, we can prevent problems in that individuals. And so our data is beginning to suggest that what's occurring is that these alterations in these genes increase the smooth muscle cells growth rate or proliferation rate, as we call it, and that we may be able to block this proliferation using anti-cancer drugs at a much lower dose than we use in cancer. So that's where we're going, and so I just want to mention that we're still recruiting for our Moya disease studies. Elena Checki, one of the genetic counselors who works with me, is really focused on recruiting. Why don't you say up there? And I'm sure many of you have talked to her on the phone. And so what we need is pretty simple. In fact, if you want to participate, you never ever have to leave your house. We need a DNA sample. We can get DNA from, as many of you know from watching CSI, we can get it, so we can get it from saliva, we can get it from blood, we can get it from your fingernail clippings, whatever you're willing to give us. But we prefer blood first, then saliva. And certainly with the kids, most of them, so we give people cups and we let them spit into the cups, and that usually takes 10 to 15 minutes to get enough spit. Kids love to do it, especially boys. One time they used to say, just go ahead and spit all you want to. We need your medical records pertaining to Moya disease, and we need to get a family history to look at what's running in the family. And then and we need the medical records to back up what you tell us so that we know for sure what we're dealing with. And then here's Elena's contact information. She and I will be here for the next 2, 3, 4 hours, and we're happy to talk with you about the studies. She brought saliva kits, and so what we want to do is use the best genetic technology to start really ramping up and finding these genes. And so to be able to do whole genome sequencing, to sequence through those 3 billion bits of DNA to find the alteration, we actually need blood. So there may be some of you that would come back and say, you're a great family or individual for us to really find a gene. So it's not going to be everybody, but a few of you, we may ask for blood from you and from you and perhaps other people in the family, because you give us the power to find the gene. And so, but most of you, saliva sample is sufficient. And once again, if we do find something that has implications clinically in your family, we will report that back to you with the note that we are not a diagnostic lab and that you have to have this tested, repeated in a diagnostic lab before you use it clinically. And like I said, we're setting up with diagnostic labs to do testing in these genes. ACTA2 we set up like 3 or 4 years ago, and we routinely, as we identify, because we're working on other vascular diseases too, but as we find these genes, we farm them into the diagnostic lab so they get translated into clinical care as rapidly as we can. So at this point, I think we're ready to push this, at least the Asian variant, into diagnostic labs. So we're talking to people about that already. These are people that work on the study, so I just want to mention, I actually just sit in my lab and write grants and papers and think about this. It's other people like Elena that actually do all the work. So Elena has been working on recruiting patients, and many of you talked to her. Before she was involved in this, it was Ellen Regalado, And many of you met her at the San Antonio meeting. And Scott was also,
Yeah.
Bourgeois was also, but he was a medical student that was just working with us for a few months. Don Chongo is the physician, the scientist that does all of the oversees all of the DNA sequencing. And Christina and Jamae are two postdoctoral fellows that have been working on those mouse models, doing all this study. I gave you a very simplistic picture. It takes a lot of time to make them because you have to molecularly engineer the models. Then you have to grow them up and breed them up, and you get it takes a lot of work, and they've been working very hard on this. So, and I want to mention that Moya disease is a rare disease, and as is cystic fibrosis and some others. And I would urge all of you to band together and start pushing for more funding for research for this disease. I think we are at a point where we can really make a difference in treating this disease and preventing strokes in people that are at risk, okay? And we can't do that without research funding. So I have some funding from the National Institute of Health to help us make these animal models. But they gave me the money to study the aortic disease, not the cerebral vascular disease. So we're doing that through funding. I run the John Ritter Research Program. The Ritter family has allowed me to use John's name because he died of aortic disease. And then his brother was found, had multiple strokes, and then was found to also have aortic disease. So he has, we think it's in the Ritter family, it's one gene causing strokes and aortic disease. But it's not the ACT2, and we don't know what it is. And so we use John Ritter's name to help us raise funds for our research. And then there's some foundations in Houston, especially the Vivian Smith Foundation. Vivian Smith is a woman who died of a stroke and had a lot of money, and in her will they set up a foundation, and they've been incredibly generous in funding this Moya disease research for us because they think we're doing good work, but also it was her mission to find the genes that cause early onset stroke. That's part of it. So, and then there's a couple other foundations that provide funding also. Yes?
How do you suggest approaching that?
So there's two ways. One is that you start, so there's rare disease groups have organized into a rare disease organization that does lobbying in Washington, D.C., so you can work through the rare disease organization. So if you just Google that, it'll put you in contact with that. And the more voices you have as a group, the larger you'll sound in that. And then number two, and certainly you should be going, there's different institutes at the National Institute of Health, and there's one focused on strokes. And that's where you should really focus your effort, get to know the people there, and push for funding for Moya disease. The other way is to group together and go out and raise funds. That's what, cystic fibrosis has done that. And they've done it incredibly successful. So if you raise funds through, fundraising, galas, runs, golf tournaments, or whatever, you can put that money together and start funding research. Labs that are working on this. So a lot of my funding for other vascular diseases comes from patient organizations that are intent on providing money to study their disease. So in the little people, the dwarfs that have a predisposition to Moya disease, they raised money, and then they came to me and said, will you make an animal model to figure out why we have Moya disease, okay? Because we don't want the people that have this condition to continue to have strokes. And so they provided the funds, and we're making that animal models, just like we made the ACT2 and somebody else made the neurofibromatosis. We're actually making the model to study why in those patients do they have an increased risk, and can we block it using these types of drugs. So that's just an example of how, and sometimes it's finding somebody that has a little bit deeper pockets to be able to provide a chunk of money. Yeah.
So if we do that, would you give us permission to say, we're doing like a fundraising thing to say, we're raising funds to fund research through,
I'd be
your-
honored if you were funding, working to raise funds for my research.
Okay.
But at the same time, it would be good to raise funds so that you could pull in more researchers working on it. So it's not just me working on this disease. And I know Dr. Steinberg has had an interest, and we collaborate quite a bit. But I know he has an interest in research, but in different questions. Are they doing the best neurosurgical techniques? And can they improve that? That's a great research question. Can they push it where, in studies like, should you repair both sides when you're going in to do one side? And questions like that are so important for people with moyamoya disease. Maybe not important for you or your family member, but for the next generation to improve. Okay, well, like I said, Elena and I will be here for the next few hours, and please feel free to come talk with us and ask any further questions that you have. So thank you.